Hi, it's my pleasure to introduce Dr. Lauren Taylor. Dr. Lauren Taylor is the head of our Consultation Liaison Psychiatry Service. Lauren is not only a CL psychiatrist but a neuropsychiatrist. I'm really pleased to have her here. Hi Lauren, thanks for joining us.
Hi James, great to be here.
Lauren, could you tell us about the role of the CL Psychiatry Service here in Tamworth?
Yeah, sure James. So really the CL Psychiatry Service provides assessment and management recommendations to patients who are in the Tamworth General Hospital, and those assessment and management recommendations tend to come in several kind of categories. So firstly, they can be in relation to patients who've got medical or surgical complications or consequences of a mental illness or disorder. So I guess an example of that might be instances of fairly severe deliberate self-harm or of suicide attempts that require intensive medical or surgical care. The second patient group is patients who need diagnostic clarification, where their medical process or medical illness might be manifesting with psychiatric symptoms. This is a really interesting patient group. So some of the kind of hot topics in psychoimmunology and that kind of area would fall into this category. So if we think about NMDA receptor encephalitis, or perhaps where people are having temporal lobe seizures and they're experiencing perceptual symptoms as a direct result of the seizure. So that's a kind of patient group where consultation liaison psychiatry can really provide assistance in diagnostic clarification and management assistance. The other important patient groups are those who've got severe and chronic major mental illness, whose rate of medical comorbidity is actually markedly increased compared with the general population who don't have major mental illness. So this is really being recognised as quite a scandal actually, that people with major mental illness actually have a life expectancy that's about 20 years less than those in the general population without major mental illness. So advocacy and optimal management of those severe mental illnesses and assistance for the team in optimally managing those patients and ensuring that they receive the medical care that they require is another really important role of a CL psychiatry team. The other areas in which we can provide assistance are in diagnostic clarification again, and then management recommendations for patients who might have very severe deliriums or behavioural and psychological symptoms of dementia. And I would also say that we have an educational role, and I'm really keen to provide support to the general hospital system, to teams and to nursing staffs in an educational way. So I'm happy to be approached at any time about that if I can help.
Great. Lauren, could you tell us the process of referring to the CL Psychiatry Service?
Sure, be my pleasure. So the way that people can refer is by calling the CL Psychiatry referral number, and that number is coming up on your screen right now. And our friendly admin assistants will take down some of the demographics of the patient. And really the reason that we're doing that, James, is to make sure that we capture the number of referrals, the demographic data, so that we can demonstrate really the need for this service. So I appreciate people providing that information and them being transferred through to the registrar so they can have a or phone conversation to really specifically discuss what their concerns are and how we might be able to help. Now, the clearer that a question is that is posed to the CL team, the more useful the consult and the result is likely to be. So if there's a clear question that's being asked, that's really helpful.
Fantastic. Thanks for your time, Lauren.
Thank you.